truthaboutobamacare.com. Tell your neighbors. Let's stop the appropriations in November.
One more question. Can you come to the stage, please? Two more. Can you come to the stage?
Mine is not a question, but it's just to tell you a fact. My son works for Humana Insurance and was in health insurance, and no one talked about they let 4,000 people go when the health care bill passed, and they are no longer in the healthcare industry, and that's a huge company. So add that to your...
Yeah. I want to comment on that. Thank you for bringing that up. That brings me to another topic I forgot to bring up. Please be careful, folks, in the next few months, up until whether we know we're going to stop the appropriations or not. Because health insurance agents like myself, brokers, their commissions are being cut drastically as we speak. So let me give you an example. If you write a policy for an insurance company called Assurant Health, right, and you collect from them a monthly premium of $300 a month, okay? Your commission as a career agent is anywhere from 22 to 25% of that premium. Now you're going to know what all your agents make, okay? But they can't survive on 20% of $300. So the insurance company says, you've written good business. We know they'll continue to pay their premiums. You're not a screwball. So we're going to advance you 12 months worth of that money up front because you write good business. And as long as your clients stay on the books, we'll keep advancing you every time you write a new piece of business. So a guy that's writing for Assurant Health, for example, can make $1,000, $1,500 per health insurance application. As of June 2nd, they now make a maximum of $300 up front. So these guys who are making $1,200 to $1,500 an application are now making $300. So those agents who are less reputable than myself, they are now going to be pushing schedule plans and discount plans. I shut down one of them last week by calling the Department of Insurance. They weren't filed with the Department of Insurance. They had nothing on record, but they were using on their website, thanks to Obamacare, there's no more pre-existing conditions. Okay? That doesn't start for adults until 2014. So what they're doing is they're lying, using the ignorance of the public to prey on the public. And you will see more and more of those. Why? Because the agents who are less reputable still have to make a living, right? So they're going to be out there selling schedule plans, which are very, very dangerous, and discount plans, because they can still make the same commission on those products because those products are not regulated by any insurance department and they're not regulated by under Obamacare. They don't have to follow into the guidelines and parameters for the 4 plans, gold, silver, platinum, bronze, that will be sold in the exchanges in 2014. So that's another negative ramification of Obamacare. There are so many more. But that's something to watch out for until November and beyond. Yeah, go ahead.
What impact will Obamacare have on Medicare?
Okay, one of the bad things is I forgot my Medicare list, but you'll find it on truthaboutobamacare.com. There's a list all the way down of all the Medicare cuts that will come to seniors. They are severe. Things like you can't buy a wheelchair until you rent one for 14 weeks. Medicare cuts on, this is the big one, on diagnostic testing. And the reason that they cut diagnostic testing, and Dr. Brown will tell you this when I speak with him, if you cut diagnostic testing, you're not going to find the tumors. If you don't find the tumors, you don't have to pay for long-term care treatment for cancer. So it's a way of lowering costs. That's just one of them. Reagan suffered from dementia for 15 years. They're cutting treatment to psychiatric hospitals that treat our senior citizens. Many of these people stormed the beaches of Normandy and saved this country and this world from the worst tyranny we've ever seen. And they paid into Medicare their entire lives. And they're cutting it across the board so they can give health insurance to 30 million people and still leave 20 million people uninsured. It's a travesty.
One more question and then we'll need to go on with our agenda.
My husband's an orthopedic surgeon. They're cutting back on payments to doctors. And places like the Mayo Clinic in 2 states now are not taking Medicare patients. We are on Medicare ourselves. We don't want to do that. What do? They're cutting back on the health. So that means all the senior citizens are going to die.
Yeah. We just passed the doc fix, which was not included in Obamacare because it cost $208 billion. That doc fix now has reduced payment to physicians by 21% for Medicare recipients. So we already had the notification, like she mentioned, of Mayo Clinic in Arizona shutting down because they took a $800 billion or $1 million loss last year by treating Medicare recipients. Now they got to cut their reimbursement by 21%. So I'll give you an example. Dr. Ari Friedman, who ran for the Congress in the 10th District, he is the only physician left in the entire northern Illinois area that is treating children of TRICARE, our military men and servicewomen, because he doesn't even make any money. And so there are doctors across the country now. This is why we're seeing all these articles about doctors saying we can't stay in the industry anymore because it's no longer profitable for us. So the Medicare reimbursement ratio for physicians is already an insult to the physician. Now we want to cut it by 21%. So this is how we provide health insurance for 33 million new people, by cutting costs for those of us who have paid into the system our whole lives. And again, it is a travesty.
Thank you, Steve. Let's thank Steve. Valuable information.